Welcome back. The Gauteng Health Department is calling for responsible behaviour, sexual behaviour, in the wake of a surge in sexually transmitted infections across the province. Now, between April and December of last year, 40% of men or 67,400 patients who visited public health facilities presented with male urethritis syndrome. This condition is commonly, but not always, a STI, a sexually transmitted infection. Let's get you some more analysis on what the situation is. Joining us is Thilivhali Livhadi, who is Love Life's Gauteng manager, and Thembisile, who is the CEO of the SA National AIDS Council. To both of our guests, thanks very much indeed for coming on. Thilivhali, I want to begin with you as the Love Life Gauteng manager. What do we make of these rising numbers? And perhaps it's just to get a sort of a perspective and some context to the story. How is this different from the previous year's numbers?
Well, good afternoon, Michelle, and good afternoon, Dr. Thembi, and our viewers. The first thing is that we need to appreciate as Love Life and welcome the report by the government, in particular the Provincial Department of Health, in releasing the statistics, because in this we are able to see that we have government taking serious these targeted services, especially for young people at healthcare facilities, that we are able to trace what services are being offered. We are able to trace the impact that these services are making on the ground, and in particular to young people. So we really commend the department for releasing the statistics. But what is clear to us is that we are able to see that as a province or as a nation, we are letting our guards down, on the eve of succeeding in dealing with issues of HIV and AIDS in our country. We are moving to HIV and free generation towards 2030, but now this report is telling us that the picture is not as much as we expect. It tells us that there is not much usage of condoms or other contraceptive method by young people in the province and in the country in particular. It's a sad story to come across this report. It tells us that we need to intensify our programs on the ground. It tells us, and the timing is very accurate for us as Love Life, because this is Valentine's week, the love month, where most of the things would be happening. And we need to stress that when we talk about young people here, they are not alone. We are talking about young people who are having unprotected sex with adults or senior members of our society. So it means the usage of condoms here is cut across. It's not only to our young people.
Dr. Xulu, when you hear this news and when you hear these numbers, what does it tell you about, as Thilivhali just said, the fight against HIV and AIDS, one that we are making great strides in? What comes to mind for you?
Thanks, Michelle, and good afternoon to your viewers and to my colleague from Love Life. What comes to mind for me is that it is really concerning, because these numbers are very aligned with the findings of the HSRC survey that condom use in this country is declining. And when STIs are on the rise, it means HIV is on the rise. And because it's young people, issues of teenage pregnancy come into the fore. And the more we then dig into STIs, you think about the shame and the stigma that's associated with that, and how people don't come forward to get treatment for STIs and end up suffering long-term complications, which also prevents us getting access to their sexual partners. And it just contributes to a vicious cycle. And what comes to mind to me, Michelle, is that we really need to be thinking about more empowerment, especially of these young people, and empowering them with information that is going to make them aware that they have responsibility and accountability for the decisions that they make in terms of their sexual and reproductive health.
I suppose, sort of a good upside to the story is that we do have these monitoring mechanisms in place, right? So this is an issue that's now been flagged, and Dr. Xulu, something can be done.
Something can definitely be done, but it all starts with the amount of information that we can get out to people around the fact that STIs can be treated. You know, most STIs are curable, and the key thing is to remove the stigma and the shame, but also to give the people, confidence that we are now actually able to do point-of-care testing for STIs at a facility, diagnose you properly, give you treatment, and if you stay on that treatment, you can be cured of most of the STIs and, reduce the risk of developing drug resistance, and also give us the opportunity to contact your sexual partners so they can also get access to treatment.
Yeah, and just encourage that kind of responsible behavior and that kind of accountability. Thilivhali, what does this mean now for the kinds of campaigns that Love Life will focus on in the wake of a surge like this?
Yeah, it talks to intensification of information dissemination to our young people in particular, and also to speak much about multiple concurrent relationship or partnerships that our people are engaged in. Young people should understand that if I sleep with my partner, who I do not know much about him, he might be having 10 other partners that he might be sleeping with. And if I also have my other partner, it means my other partner is, literally also sleeping with those 10 that my partner is sleeping with. And I think this is the message that young people should understand. And you begin to have these symptoms of STIs that you keep quiet, issues of not sharing with your parents about these issues of not visiting clinics. And we are saying as Love Life, we have established youth zone in partnership with the Department of Health at the healthcare facilities where, particularly for young people, when you visit the clinic, we have made sure that you have a dedicated area, which is a youth zone, where young people go there and have attended by a young nurse who understand, would be able to communicate with them easily, because it's difficult, we know, for young people to communicate the STI or sexual reproductive health issues with old people.
Yeah.
So we make sure that we have these dedicated services and dedicated personnel at the youth zone. And we are saying, let us have media playing its role as well in intensifying messaging around these issues, because we can't win this war alone. We need all of us to be partners and to drive this message so that in 2030, we then sing the song together.
Dr. Xulu, this issue of shame versus access to treatment is always an ongoing one, right? And one that we're trying to change at our clinics all the time. In your experience, are we making that kind of difference where young people feel safe enough, they don't feel judged, essentially so that they can get life-saving treatment and advice?
We are certainly turning the corner, Michelle, because the key lies in the level of information that I think our clients, our populations have in terms of treatment being available, readily available within the public sector, the fact that treatment works, but also a huge level of effort is being put into making sure that the health service itself is able to render services to our clients without making them feel a certain type of way. My colleagues has just mentioned youth-friendly zones, key populations-friendly zones, men-friendly zones, because men also struggle to get access to health services. And that speaks to creating an environment that will allow a client to open up about a sexually transmitted infection, and for the healthcare worker to probe in order to make sure that the client does get assistance. Okay,
so let's go into the symptoms of MUS, Male Urethritis Syndrome. Hopefully I'm pronouncing that correctly. Dr. Xulu, for those of us who are watching and need this kind of information, what should I be on the lookout for?
All right, so male urethritis syndrome is a presentation of a sexually transmitted infection in a male. We use that as a proxy for all sexually transmitted infections. So male urethritis in a man would be burning of urination, it would be frequency, but the commonest would be a penile discharge. So that would be the most common one. And if left untreated for long, it can end up causing something like testiculitis. Because we use this as a proxy, what we would see in women with an STI would start from something as a vaginal discharge that is discolored or has an odor. They might have lower abdominal pain to the point of having ulcers or sores around the anal area or the vaginal area. And then over time, it can progress, to cause pelvic inflammatory disease and serious long-term complications like infertility. So these are the signs that people should be on the lookout for, but come forward for assistance so that we can help them and their partners.
Yeah.